Good morning, professors. My name is Kha Quang Hien. Currently, I'm a student of Taipei Medical University. Today, I'm going to talk about my thesis with the title of DFIPred, a novel machine learning-based prediction model for drug-food interactions from chemical structures. Possible food and drug interactions could change the intended efficiency of therapies in clinical practice. The increasing number of multiple drug prescriptions is prone to the rise of drug-drug and drug-food interactions as well. The presence of these interactions can lead to other consequences, such as the decline in drugs' effect, the withdrawals of drugs, and the detrimental impacts on the patient's health. However, the importance of drug-food interactions is remained underestimated, as the number of studies referring to these topics is very constrained. Recently, the state-of-the-art machine learning models have been developed to discover the influences between drug and food constituents. That said, there were still some limitations in terms of data mining, data input, and detailed annotations. In this study, we proposed a novel machine learning-based prediction model that could address more drawbacks of older models. A total of 4,384 food and 334 drug constituents were included in our training set, and 2 validation sets were prepared for the model assessment. VNEAT package has been used to obtain the chemical features, and then the feature selection has been performed to select 25 most important features. The performance of our model was highly promising, as the accuracy score was 88.28% and 92.18% on the internal and external validation, respectively. More importantly, the DFIPred can recommend about the interaction of any given pair of one drug and one food constituent based on their compound names only. We believe that our model could contribute to the prediction of drug-food interactions in the future. And this is our workflow here. For the first step, we try to extract the data from the public database of FoodB and Drug Bank. So we had 70,477 food compared to 10,691 drug compounds. After the data preprocessing step, only 4,384 food compounds and 334 drug compounds were included in our training set. For the next step, we will try to use the VNEAT package in Python programming language in order to compute the SMILES formula into the number of chemical features. And also, we try to label the interactions. If the impact of the food constituents was to increase the bioavailability, concentration, or absorption rate of the drug, but did not include the risk of adverse events caused by that medication, that impact was defined as positive interactions. Otherwise, the impact would be defined as negative interaction. So, after that, we try to use the shape HHAP analysis package in Python to have 25 optimal features. And final, the optimal algorithm is the decision tree classifier to build the DFIPred classifier. The DFIPred later will be used to evaluate on the internal and external validation set, and finally we will use DFIPred to recommend about the interaction of one drug and one food in real practice, in real clinical practice. So this is the end of my presentation. Thank you very much for your attention.